Can you
Okay.
show us how the system works?
Yes. So this is a model of our cycler. We have a newer model that has a touchscreen called the Versi cycler, but it weighs about 85 pounds. It's about the whole setup with the cycler and the pure flow is about 2.5 by 2 feet. It's kind of like a bedside table. And then to set up the cycler, we have something called a cartridge. It's pre-lined with the dialyzer and lines. So all the patients would need to do is just insert this cartridge into the cycler and then hang a saline bag and push one button to prime the lines with saline. That's how easy it is. It takes about 23 minutes for the lines to prime and remove all the air from the dialyzer and lines. Um, Overnight, about 5 to 6 hours, this is called a sack. The city water will come and fill up the sack over 5 to 6 hours overnight. And it would make a 30, 40, 50, 60 liter sack. So this is the sack that will clean their blood during treatment.
So that sounds like it's huge. 40
Yes,
liters? I
yes,
couldn't
but
lift that.
it's very heavy, and that's what the pure flow system is. But when they travel, they have the option of they have to use the pre-filled dialysate hanging bag. So this is what their travel setup will look like. So we would let them borrow like a hard or soft traveling case, and they would just take the cycler with them, leave it at the bottom of the jetway, and then we would send the cartridges and these pre-filled dialysate hanging bags to their hotel room or their place of residence when they travel only within the United States.
Well, that's a nice
So
feature. I hadn't thought about that.
yes, so especially with COVID, traveling, they want everything be safe. So I actually have a patient traveling to Vegas just over the weekend, and
Of course.
they want to do dialysis, in the hotel room. So instead of like, doing all the paperwork, going in center and waiting for their chair time over there at, whenever it's convenient for the in center, but they can now do their dialysis in their hotel room.
Very nice.
So they're very happy with that.
Can you tell us about the supplies that are required for home hemodialysis and how the patient gets them?
Yes. So with home hemodialysis, we will provide everything from the dialysis chair if the patient needs one, or they can dialyze in their bed or their own recliner at their home. We'll give them a blood pressure cuff, a scale, of course, the cycler, warmer, the pure flow system, all the supplies from the needles, syringes, any other medications, the gauze, the mask, the gloves, hand sanitizer. We provide all of that. And then for their supplies, they get about 20 boxes a month for the cartridges, the dialysate stacks. They'll have a purifying pack that they'll have to change out once a month, and the emergency pre-filled hanging bags that we would also deliver. So they'll need at least 3 days worth of these pre-filled hanging bags just in case of emergencies. So it's not as much supplies as peritoneal dialysis. So it's about 20 boxes a month. We'll order it through and have it delivered to their home.
What do home hemodialysis patients need to do in disposing of the supplies when they're finished with them?
Yes, for their cartridges and their sacks, they can actually just dispose it in their home trash. So I like to tell my patients to keep their dialysis supply waste and like their home waste separate, and then they can dispose of it there.
How do they dispose of the used needles?
Yes, so for the used needles and syringes, they would discard it in their bio waste trash, and then we could dispose of it for them, or they can close it and then wrap it in a bag and throw it in their trash.
The used fluids can go into the regular sewer lines?
Yes. So our pure flow, it has like a draining system, so that's what it'll drain. It'll drain into the sink,
Okay.
or to that drain line.
I just remembered I didn't hear if pets are okay for home hemodialysis.
Oh, yes. So for the home assessment, yes, pets are okay to be in the home as long as the pet isn't around them when they're accessing and deaccessing their access. Yeah, so it doesn't have to be sterile, but at least clean. And we like all the fans and ACs, air conditionings to be off, so it doesn't circulate any, any fur, bacteria, dust that might be in the air. And then, we do teach all our patients like proper infection control from hand washing, mask, gloves, and all that. So like the patient is safe and they keep everything infection control free.
You've mentioned that COVID-19 has made home hemodialysis perhaps more attractive to people. Has it changed any of your procedures? You mentioned home visits. Do you still do home visits?
Yes. So in terms of, working through the pandemic right now, we screen all our patients prior to going to the home, or we would use our Google Duo to do virtual assessments as well.
Do they need to come in and to the clinic periodically just to check in and make sure everything's on track?
Our patients are required to come in for a monthly clinic visit with the nurses, and they also have to see their nephrologist in their monthly as well. But right now, everything has been more telehealth visits with Google Duo and checking in with them. We'd still call them on the phone every day if, they need any help, or if we see their weights going up or their blood pressures, we're monitoring that. So we have something called a Next to Me Connected Health. We give the patients an iPad where they can document all their vital signs and medications, and they can take notes to us. And so once they're done with their treatment and confirm their flow sheet to us, then we can view it and review their flow sheet. So, and then we can also see all the alarms that they receive on the machine. So yeah, it's very an advanced system. It's very impressive.
It sounds like it.
Yeah.
Do they take their own blood samples for lab work? How does that work?
Yes, so for home hemodialysis, they can do everything. They can take their own blood samples since they are accessing their fistula, graft, or catheter. We teach them how to draw blood samples, and we also teach them how to spin them in the centrifuge, and they can drop it off at the clinic once it's drawn.
Sounds like they have their own mini lab at home.
Yeah, they can do everything. Everything is hands-on for them. And they can also administer their own medications. We teach that also during training.
When someone is first identified to need dialysis, what are the considerations that come into play for selecting a particular type of dialysis?
When a patient, finds out that they do need to go on dialysis, the nephrologist would, give all the different options of the different modalities of dialysis. So it could be hemodialysis, which could be broken down into the chronic in-center hemodialysis or home hemodialysis, and then peritoneal dialysis. For peritoneal dialysis, I know that nephrologists like to start the patient on that modality first. If the patient is younger, they want to preserve their veins, or if the patient is scared of blood and needles, then they would kind of go that route for peritoneal dialysis. And because peritoneal dialysis is a beautiful modality as well, like they dialyze even better than home hemodialysis and at a way slower rate. So their lab work is also really good as well. And we see a lot of kidney transplant as well. And of course, they don't have to deal with blood or needles, and it's just a more simple connection and process than home hemodialysis. Like we have a lot of connections and lines going on versus peritoneal dialysis. So, and then with chronic, hemodialysis. That's where majority of all our patients start. Usually it's, they kind of go into the ER really sick, and then it's kind of like, bam, you need to start, hemodialysis urgently. And they don't have all that time to figure out like the different options. So that's why we still like would go doing lobby days or virtual lobby days. And then we're going around to all the clinics and educating more about to the staff about home hemodialysis, so they can educate their patients that in center doesn't have to be the only option, and then this modality is available to them as well. So yeah, so usually we have been getting a lot of patients in center. They'll start in center first, kind of like for about a month or so, start to feel better, and then we would kind of like slide in there and be like, would you be interested in this option? You're still working, or you still are the primary like caregiver for your family, like this would be a good option for them. Or if they're missing treatments, cutting their time because of like personal reasons, like this could also be a good option for them as well, because they can do it at the convenience of their own time and at home, and all that time wasted like driving and waiting, it's all precious time that you can't get back.
I'm also wondering about power outages and emergencies. I assume the clinics have backups, but what do home hemodialysis patients do in that event?
Yeah, so unfortunately, our cycler doesn't have a backup power generator. If they were on treatment, we do teach them how to emergency rinse back, and then when the power does come back on, then they can restart their treatment, or they would just make up their time on a different day or make up their treatment on a different day. But if like the power doesn't come back on, it's kind of the same with all dialysis patients. They would go into like their medical emergency diet, preparedness.
I've not heard of a medical emergency diet. What's that?
So basically for the emergency diet that they would go into if they can't come to the dialysis clinic, or if there's like a major storm or hurricane, like we had the Hurricane Douglas, we were preparing all our patients to go into emergency diet. So they would restrict all, like fluids and their potassium intake, phosphorus intake, and just to really monitor what they're eating if we couldn't get into the dialysis clinic.
Okay. I have heard a lot of patients first get onto dialysis in the emergency room because either they are unaware that they have chronic kidney disease, or they haven't been seeing their doctor frequently. And I've also heard that there's a push to educate patients so that they can get a fistula surgery early enough so that when they do need dialysis, they have a good access point. What's been your experience with the timing of getting the fistula relative to when dialysis starts?
Yes. So ideally, we would like our patients to already have a fistula prior to starting dialysis, but it also depends on the patient. Sometimes they could be in denial or not following up with their nephrologist right away. It depends on like how their like GFR, creatinine, BUN levels are in other labs are, but it'll be the nephrologist to refer the patient to the vascular surgeon, when is the right timing so we can get that fistula matured. Sometimes the fistula can take about 3 months, or it could take 6 months. It all depends on the vein and of the patient. But if they have to start, urgent start with a catheter, which is the least access that we would recommend because it's high risk for infection. As soon as the patient, gets admitted with a catheter, we already start contacting the nephrologist to refer the patient for a vascular consult, so we can already get a fistula or graft placed in. So hopefully within like 30 months, we can already have a permanent access, either fistula or graft. And once successfully using it, then we can ask for catheter removal.
Can you tell me what the difference between a fistula and a graft is?
Yes. So a fistula, a vascular surgeon would surgically connect the patient's own artery and vein. With the graft, it's connected, maybe their veins are too small, so the vascular surgeon will connect the artery and vein with a synthetic tube.
Okay.
Yeah.
Thank you.
You're welcome.
For patients who may be fearful of taking on this responsibility themselves or dealing with needles themselves, do you have any advice that might help them feel more confident in using home hemodialysis?
That's what majority of our patients, they do start home hemodialysis. It's because, they want to live longer to see their grandkids, or they want to live longer to, be there for their kids and watch their grandkids graduate high school, college, and be more present, in their families' lives. And a huge component of this is also like the family support, because this is a whole, you know, system that's going to be in their home. And yeah, so sometimes it's a lot, but when they have their loved one and they can see that they feel better and everything, then yeah, they're very, very happy. And we just had like a home hemodialysis patient last week get a kidney transplant. They're very, very happy for them, and we have a few on the list. So even though we're training and you know getting more patients, we're kind of losing them too to transplant, but that's a good thing.
That's a good thing.
So you see, like our modality, it's really, really good for the patient and their families overall. So if you're scared, I suggest just try, and we're here and all the nurses are here 24/7 for any problems, or yeah, we're always available to help them. Yeah.
It also sounds like it's possible to start in the clinic to just become accustomed to the process and more familiar with it,
Yes.
and then move into home hemodialysis once you feel ready for it.
Because I tend to find like patients, they kind of have to go into the ER, urgent start, they're not feeling good, and it takes them a while to get out of those uremic symptoms and to actually comprehend what's going on. And there's kind of like a little of that denial and depression stages. So once we kind of get through that, and then that's when like we'll come in and just see how they're doing. And like our goal for them is to try to live this, if this is going to be their new normal and their new life, like just try to make it a little bit easier for them. So like our goal is for them to keep working and to keep like being active in all their activities, extracurricular activities, their ability to travel and to spend time with loved ones, and to actually be present in that, and not to always feel like fatigued and tired, or I can't go to this family party because I have to go to dialysis, so, or I have to miss this event or this graduation party because my chair time is at this time. So at least with that, they're not losing that whole quality of life component.
Those are all really important things.
Yes. So when I started, one of my patients from in-center, we did his home assessment, and he had a boat in his garage, and it was just filled with things. And I was just like, wow, I didn't know you have a boat. And he's like, yeah, he's like, guess how long it has been sitting there? And when I was like, how long? He's like, 3 years, because I've been on dialysis for 3 years. I was like, just hold on, just wait, and then most recently he bought a new engine for the boat, and then he's waiting to go out. Now he has all this energy and this time, and he can't wait to bring like his family out on the water with him. And yeah, it's a really beautiful thing. And this patient stories that they tell us, how good they feel, and even like their care partners, their wives, their husbands, they're just so happy. So yeah, so I would recommend home hemodialysis.
It does sound like a great option.
Yes.
Thank you so much for taking the time to explain all this today,
You're
and
welcome.
for the stories as well. They're really cool.
You're welcome. Okay, thank you. Aloha.